Started now. So welcome all and thank you for participating to our One Health Seminar LenZes. This one is presented by Professor Marta Cohen. And it's my pleasure to introduce her. She's a tenured professor of architecture in the College of Design, Construction and Planning here at the University of Florida. And she's also director of the Center for Hydrogen-Generated Urbanism. She arrived at UF in 2003 and as the director of the School of Architecture. And her recent research has focused on the impact of civil unrest on human settlements. Their ongoing research is focusing on the impact of the pandemic in the built environment, which I think is what she's also going to talk about today. And her research concentrated in Puerto Rico, Florida, New York, and Italy. Also in conjunction, some project with the Polytechnic of Milan and our very own One Health Center here at UF. So without further ado, I'm excited to hear more about your research. So thank you very much, Professor Cohen, and the floor is yours.
Thank you very much, Constanza. And I appreciate very much the opportunity that we have to showcase the work of our students and our own work. So shall we, as an introduction, I want to say that it's in the framework of our graduate seminar course at the School of Architecture and the University of Florida, that the professor and the students engaged in a research itinerary that explored the different aspects of the incidence between pandemic and its physical interface. We were very interested in this connection. The goal is to analyze data from multiple official sources, public, governmental, at different levels, as well as NGOs, press, and academia, to establish meaningful correlations capable of identifying and suggesting planning outcomes, policies, design strategies, to address the mitigation of the perceived long-term incidence of this or similar occurrences in the future. So we do look for this association between COVID incidents and the built environment. We have social vulnerabilities to consider and urban risks to consider. Our main 4 interconnected factors would be climate change, pandemic incidents, and health conditions, critical economic and environmental conditions, and racial inequities. So inequities have led to economic vulnerabilities and environmental degradation, as well as settlements in areas subjected to the effects of climate change and heavy infrastructure. So though other factors intervene, we have selected the most significant ones. And it is our hypothesis in this research that the current collection of the COVID-19 incident data, georeference data, can act as a marker of the other 3 conditions, even if it's not an exclusive marker, and that the challenge for us is to establish links and connections, connecting them between the risk factors and the built environment conditions to derive strategic directions for recommendations. So we go through all the scales, we encompass a range between the urban level, public space, transportation, work, education, you name it, consumption, assembly, to the neighborhood level, densities, health services, infrastructure, collective assets, to the building level, which would be inequitable housing, overcrowding, collective living. So the preliminary conclusions of this approach identify the occurrence of hotspots of primary focus in addressing the mitigation for the pandemic and generate associations between the components that can better limit its incidence. So these associations will directly inform the design decisions at all levels of the spectrum, from urban to building. And we have developed this in the research, and it's an ongoing research. We will continue during the fall. So I would like to introduce our students that have developed this research, and it's Casey, Daniel, Erin, Blanchard, and Daniela. And so here they are our UF jewels, and it's all yours. Go ahead.
Hello, my name is Daniela. So like Martha mentioned earlier, there are a few conclusions that we came to during our research that we wanted to start off the presentation with in order to give better context for the following presentations. We have identified correlations between the built environment and COVID-19. This identification has led to the most meaningful indicators that regarding correlations of conditions and incidents. These types of identification and indicators lead to the possibility of developing recommendations that include recommendations in codes, policies, and mitigation strategies and investments. The application of these recommendations could have significant impacts in the short term and medium term for the well-being of populations during the pandemic and after the pandemic. These studies have been driven by the availability of data and interdisciplinary associations. At the beginning of the semester, we came up with a word map associating things of the built environment to COVID. The 5 topics that we chose to expand on were public spaces, social vulnerabilities, urbanism, culture, and housing. We found through our research that a lot of these topics are interconnected and interrelated. The first topic we'll speak about is culture, the second, social vulnerability, third, housing, fourth, urbanism, the fifth, public spaces, and we'll go on to show some proposals, design proposals, and finalizing with some more conclusions. Now for the culture chapter or presentation, I'd like to introduce Blanchard Fagan.
Hi. So as COVID-19 spreads internationally, the comparisons of cultures during this time is at the forefront of discussions. The spread of the virus and dealing with its effects could be influenced not only by the population demographics, health status, healthcare characteristics, and the like, but also by cultural factors or the structure of social networks. In this figure, we can see that social behaviors and practices are the basis to how we live our lives and interact with others. These social behaviors then affect our health behaviors by how we conduct ourselves in social settings. And then the social behaviors and health behaviors then affect our own or others' state of health. For the purpose of our research, we have defined culture as the characteristics and knowledge of a particular group of people, encompassing language, religion, arts, value, beliefs, and practices. So what happens to culture when the spaces that are regularly used to share and express culture are now deemed hazardous? The listed venues are not only important to culture and their ideas or displays, but also in the form they take physically. The essence of a space has now been taken away from the experience of the service. With the current risk that COVID poses to people gathering, attendance in these areas of social practices has been halted or limited. So we have to consider, how can we persevere and preserve a place of culture during a pandemic that won't allow people to gather? This slide and the previous slide included examples of the ways in which we attend various cultural events like sports, concerts, or movies, and how those may change or be reimagined. US culture is extremely individualistic as it varies and values individual interests over communal interests, even if there are large consequences. When the enemy is a visible entity, a person or group, collectivism is easier to implement. However, when the enemy is invisible, such as COVID, organizing collectively is much more difficult. Perception of this type of culture is also important. When people observe those not following guidelines, they become less willing to self-sacrifice for the greater societal good because tackling this crisis requires a collective effort. Discussions of urban and rural communities have revealed that people in urban contexts are more likely to be careful and follow guidelines due to the dense nature of the population, while rural communities might feel safer in their sprawl and less likely to adhere to those recommendations. In this chart, about a third of rural counties are highly susceptible to COVID-19, and it compares communities of different sizes on different susceptibility factors, and the positive numbers show larger than average shares of people at risk, indicating those higher susceptibilities. So these rural areas stand out in a county level assessment of major risk factors of COVID-19. The vulnerabilities measured include the population's density, age and health status, presence of nursing and elder care facilities, and group facilities such as prisons. The gray area indicates little to no vulnerabilities of these factors measured, and the dark red areas indicate the highest vulnerabilities. COVID cases in rural or non-metro areas have steadily increased over the last few months as well, and are now observed to have the most cases, and they are the most at risk. And then interventions to slow disease spread are critical. So 6 measures to reduce community COVID spread through social distancing practices, such as isolating ill people, tracing contacts, quarantine of exposed persons, school dismissals or closures, changes in the workplace, and avoiding crowds and restricting movement. This diagram also shows how these policies, such as mask mandates, have been linked to a decline of infection rates. COVID has impacted all aspects of life, which has shown the significant role of cultures and how groups react to or perceive the pandemic. However, how we design spaces with culture and COVID in mind can unite individuals and communities and transcend various cultures despite certain discrepancies or difficult situations. And these are resources. And Casey Seitsinger will be talking about social vulnerability.
Hello. So we will first be looking at the social vulnerability through the lens of a case study of New York City. Those living in poor neighborhoods are at an elevated risk, as in the case of New York City. As you can see by this map that outlines COVID cases by zip code, the areas with higher amounts of cases are poorer in terms of annual income. This graph outlines COVID-19 cases in New York City by income percentile. So the top 25th percentile has only 10,000 confirmed cases, while the bottom 25th percentile has 40,000 confirmed cases. So first we'll be looking at the wealthiest zip code in New York City, located in Manhattan. As you can see on the graph to the left, this population is the wealthiest while having the lowest number of confirmed cases. The people living in this zip code are primarily young white people in their 20s to 40s. And mostly white males live in the zip code. And as you can see in this graph, there is a spike in the amount of people aged 30 to 34 and a relatively small population of people 70 years or older. And only 22% of this population is unemployed. And because of this, there is an average household income of over $200,000. So next we'll be looking at the demographics of the poorest zip code in New York City, located in Brooklyn. This zip code has a low income percentile and a high number of COVID cases. The people living in this zip code are primarily older, Black, or African Americans. The demographics of the zip code are mostly Black or African American females. The total population by age is more evenly dispersed in the zip code. However, there is a small spike in the age range 70 to 74. The amount of people unemployed is large at 56% of the population. And because of this, the average household income is under $25,000. So Black Americans are more likely to live in poverty and suffer the chronic health conditions associated with it, making them most likely to have medical conditions that are risk factors for COVID-19. Some factors that contribute to this inequality are unemployment, living in poverty, or no health insurance. This table from the CDC outlines COVID-19 cases by race and ethnicity. Compared to white, non-Hispanic people, the rate of confirmed cases is 2.6 times higher for Blacks and 2.8 times higher for Hispanics. The rate of hospitalization is 4.7 times higher for Blacks and 4.6 times higher for Hispanics compared to whites. There is also a correlation between COVID-19 and age. Among adults, the risk for severe illness from COVID-19 increases with age. This graph to the right outlines how COVID-19 affects different age groups. You can see here that there's a spike in the hospitalization rate of people over the age of 65. This vulnerability in people over 65 is in large part caused by pre-existing and underlying medical conditions such as asthma, hypertension, obesity, diabetes, and chronic kidney disease. Occupation also plays a role in social vulnerability. Service occupation workers are most vulnerable to contracting the virus, such as nurses and teachers, because of high contact. Low-income workers are also susceptible to contacting COVID-19 because they are less likely to have paid sick leave. 47% of low-wage workers and 43% of part-time workers do not have access to paid sick leave. Paid sick leave is also unequal across race and ethnicity. 54% of Hispanics and 38% of Blacks do not have access to paid sick leave, whereas 37% of whites do. The option to telecommute is also not equal among socioeconomic classes and race and ethnicity. As you can see in the graph, higher wage workers are 6 times as likely to be able to work from home as lower wage workers. And this graph shows the share of workers who can telecommute by race and ethnicity. Whites and Asians more commonly work from home. Only 19% of Blacks and 16% of Hispanics are able to work from home. So within this framework of data on culture and demographics, next we'll be talking about how the built environment plays a role. And here are my references. And then next, Erin Keating will be talking about housing inequality.
Hello. Okay, so for this research, we categorized housing into 3 major groups. So that's loss of shelter, group quarters, and living conditions. There are roughly 500,000 homeless individuals in the United States, all of which do not have the ability to self-isolate, have limited access to basic hygiene and health services. The CDC has been collecting COVID-19 data from 250 universal testing events at homeless shelters. As of October 20th, 2020, they tested just over 10,000 homeless, which is just a fraction of the total population. Iowa, Massachusetts, Pennsylvania, and California had some of the highest positivity rates, from 34 to 69%. This is a case study of New York City. This graph shows monthly deaths among New York City's homeless population. In 2019, an average of 34 homeless died each month of all causes. During April of 2020, 58 homeless people died of COVID-19. 54 of them lived in homeless shelters. This is 157% higher than the number of deaths from all causes during the average month of 2019. Evictions also fall under the category of loss of shelter. The United States is in need of nearly 7.5 million more affordable units for extremely low-income families. Even before the pandemic struck, more than 40% of renters in the United States were cost burdened, meaning they were spending more than 30% or more of their income on housing costs. According to the Aspen Institute of Financial Security Program and the COVID-19 Eviction Defense Project, estimates that between 19 and 23 million renters in the United States were at risk of eviction in 2020 due to loss of employment and other shutdown consequences. 2.1 million people in the United States live in nursing homes or long-term care facilities. This population is just 0.6% of the total US population. Astonishingly, 42% of all COVID-19 deaths in the United States were reported from this small population. It is well known that COVID-19 affects the elderly far more severely on average than younger individuals. Among the elderly population, deaths are concentrated even further among those living in long-term care facilities. I looked at New York State as a case study for nursing home COVID-19 statistics. New York has one of the largest number of nursing home residents than any other state. With this said, the nursing home fatalities are not disproportionate to the rest of the country, despite having the largest nursing home population. Data suggests that COVID-19 fatalities in nursing homes are a problem nationwide. Neighboring states to New York had similar fatalities despite having significantly smaller populations. Research from New York State Department of Health indicates employee infections were related to the larger community spread, and employee transmission has the strongest correlation to nursing home fatalities. The United States has by far the world's highest incarceration rate. In the United States, there are nearly 2.2 million incarcerated in prisons and jails. Policy has led to overcrowded populations and insufficient policies and funds to properly care for inmate health and well-being. Every level of the criminal justice system is plagued with racial bias and socioeconomic inequality. People of color make up 37% of the US population, yet they make up 67% of the prison population. The disparity in the US prison population includes health and wellness. People in prisons and jails are disproportionately likely to have chronic health problems, some of which have been linked to increased risk of COVID-19 complications. The combination of overcrowded populations and poor healthcare has led to widespread COVID-19 spread among the US prisoners and prison staff. Overcrowding conditions make it nearly impossible for social distancing, and daily shift changes of correctional officers increases the risk of the disease entering the facility. In June 2020, there was over 40,000 reported COVID-19 cases in state and federal prisons in the US. By October 15th, that number had reached 157,100 prison cases. Data from March through October indicates there has been a total of 1,246 deaths within the community. And of course, several months later, that number has increased. Data from group quarters such as prisons is critical to understanding how COVID-19 is affecting this vulnerable population. Correctional Health Services, a division of New York City's Health and Hospitals, has refused to publish critical information about the COVID-19 situation in New York jails, including the cumulative total number of people who have contracted coronavirus in DOC custody and the total number of people in DOC custody tested for the virus. This chart shows the coronavirus infection rates as of October 27th, 2020, at the height of the pandemic in New York. During this time, we can see that New York City jail population had a 9.9% infection rate, which is nearly an 8% increase from the New York City infection rate. More astonishingly, the New York City jail infection rates are higher than the displayed countries of Italy, China, and the US, despite having a fraction of the population. This chart shows the infection rates in New York City jails as of July 31st, 2020, nearly 4 months after the epicenter broke in the city. This chart indicates that the infection rate of New York City inmates is at 7.1%, While better than in April, this number is still very alarming. Compared to the New York City population, we see that the general population infections has risen to 2.7%. This indicates the gap between the incarcerated and non-incarcerated population was closing at this time, but the infection rate for those in DOC custody are at a significantly higher risk of infection. A major player in reducing the spread of the coronavirus is isolating and quarantining at home. For many residents in California, this is simply not possible. Extremely high cost of living forces multi-generation and extended families to squeeze into one house or apartment. The CalMatters team investigated how overcrowded housing may be correlating to higher infection rates among California's hardest hit communities. The research team collected COVID-19 data from zip codes from 14 of California's counties with the highest case count as of late May. They calculated the number of positive cases for every 1,000 residents and distinguished between neighborhood size and demographics. Their study suggests that the hardest hit neighborhoods had 3 times the rate of overcrowding as neighborhoods that have largely escaped high infection rates. These neighborhoods also had twice the rate of poverty. In the least affected neighborhoods, about half of the residents are white, while in neighborhoods more heavily burdened by the virus, 82% of residents are people of color. This graph shows the data from Los Angeles. It shows a clear example of where the coronavirus has hit neighborhoods with more overcrowding. The correlations between overcrowding and infection rates could be the reason why California's shelter-in-place orders have not been too successful. In wealthy neighborhoods such as Ocean Beach and Sunset Cliffs, there were 14 times fewer infected people per 1,000 residents and just 1% of overcrowded homes. The pandemic may make the overcrowding situation worse in California and other expensive cities. Instead, increased rent and job losses will force more and more families to move in together. So these are my references. And then the topic of urbanism will be discussed by Daniel Fargi.
Hello, everyone. So I focused on urbanism and specifically 3 main topics within urbanism: mental and physical health, urban blight and abandonment, and resilience and alternative spaces. So in terms of mental health, a large percentage of Americans have said in urban cities and in suburbs that, of course, the coronavirus has had a very negative impact on their mental health. A total of 19% have said that this has had a major impact on their daily lives in cities, and 26% minor impact, with females being at a much higher rate of mental health issues than males. And in terms of people who are already feeling the effects of mental health, 72% have already said that it's been disrupting their lives, of course, and 74%, so a very large percentage, fears what's still to come into the future for the next year. So regarding urban blight and decay in cities, this is have been a major problem in the past. So I'll be talking a little bit about a few of the cities that have been having problems and the current ongoing problem with urban decay. This chart from the US Census Bureau from 2012 shows fairly high vacancy rates in major American cities such as New Orleans, Jacksonville, Las Vegas. Of course, everyone knows Detroit, which is infamous for abandonment. And you can see that large percentage of vacant units, so 12% of the city's units are vacant, which equates to, as you can see, 68,000, 72,000 units. And this is projected to get worse over the next few years because of the pandemic. So this chart, also from the Census Bureau, has charted out different cities historically that have had problems with urban decay and abandonment. You can see that the vast majority of them are post manufacturing cities that are along the Rust Belt, such as Detroit, such as Flint, Cleveland, Buffalo, St. Louis. And so I'm going to start to talk a little bit about next about the cities that are going to start getting affected by this. So these two charts show the inventory by market of office space and the direct vacancy by market. So you can see, of course, that inventory, of course, the highest in the largest cities such as New York, Washington, D.C., Chicago, Dallas, LA, and direct vacancy is starting to affect major cities as well. You can see Westchester County, which is just north of New York City, has been very hard hit. Other cities like Houston, cities in New Jersey, Dallas, Fort Worth. So as to why this is happening because of the pandemic and people are starting to move away from cities is because people fear about, of course, the public health crisis that is ongoing, and people are moving to the suburbs also because of the economic fallout of the pandemic. So we must, shift with the times and target a new group of people for housing in urban centers, as I said, as families move toward the suburbs. So these are two pictures examples that showcase the ideas of how mayors and governors are trying to combat the idea of urban decay and reuse spaces since the infrastructure is already there. So this is the idea of tactical urbanism, which is also referred to by many architects and urban planners as pop-up urbanism. And they're low-cost methods and ways of temporary changing spaces and streets to allow people to still inhabit these spaces during the pandemic, socially distance outdoors. And so, as I said, they've been being rolled out across many cities, and we'll continue to see these in the next few years, even after the pandemic. So for reimagined spaces, there, of course, there's been, with the idea of the abandonment, a lot of buildings are in disrepair. There's a lot of areas in cities that historically have been hard hit, and they're going to continue because of the pandemic. So the idea of converting these areas, such as a parking lot, to a public square is a really good idea, because logistically, little work needs to be done to these areas, and these can become converted into public plazas and farmers markets, adding bicycle lanes. These are all short, low-cost methods to improve the post-COVID-19 world in the built environment. So this is an example of a parking lot that was created into a movie theater and also a farmer's market. And so the idea of this is to bring in also foot traffic, pedestrian foot traffic to the urban cities. And basically this is going to help bring back the economy to what it was before the pandemic. And all these are methods of reintroducing people to family-owned shops and to retail. In the post-COVID-19 world, the main question arising is what kinds of spaces are we willing to live and work in now? And should companies continue to let their employees work from home, or shall we slowly start to return to pre-pandemic office norm? So with the idea of having to need more office space by square footage, and of course the social distancing of the 6 feet, this is an infographic from the New Yorker. And it shows an idea that an architect proposed of a different cubicle layout with more glass partitions, and the idea of using abandoned structures and reinventing the spaces, such as abandoned, shopping malls, strip malls that aren't office buildings, is a good idea. And also we'll start to see that happen in the post-COVID-19 world for several years. So this is not the first time that architects have had to reinvent spaces and to redesign the built environment. A successful and well-known architectural example of this is Alvar Aalto's Paimio Sanatorium, which was built in 1933 in Finland. And this is a medical facility which was designed specifically for tuberculosis, which was one of the deadliest diseases at the time. And this building was made to promote recovery from the disease. And the architect later wrote after the completion of the project that the main purpose of the project is to function as a medical instrument. So the designs of the rooms were determined by depleted strength of the patients. So these included quiet colors for the ceilings, natural light sources that would enter the building, but out of the patient's field of view, and heating towards every patient's feet. So this tuberculosis pandemic and the Spanish flu in 1918 both influenced European modern architecture movements of the 1930s, such as Bauhaus, which I'm sure everyone knows about the Bauhaus. And so this is just a previous example that we are currently starting to see now with the coronavirus. And this will relate directly to the coronavirus because we're starting to see a shift in the built environment and in architectural spaces that will last throughout the decade. So lastly, this is an example of a really good method of things, NORCs, naturally occurring retirement communities. And so these NORCs have started to pop up across the US for many years. And this would be a good idea and method of using in urban cities for the post-pandemic world. Building is definitely not an aspect that
You're breaking.
Sorry, can you hear me?
Yes.
Yeah. So NORCs may develop naturally in three different types of ways. The first common form are where elderly citizens just age in place, where they have lived for years, if not decades. The second would be through emigration, where the elderly population remains in the specific community as younger individuals move out. And lastly, this idea of immigration, which could be used in a proposal for the built environment, is where numerous older people move into a specific community. And so these NORCs encourage the use of already built urban infrastructure and the idea of working with what we have rather than continuously building more additional housing when so much of it already exists and it's just sitting there unused. And so I think that the idea of NORCs will address the problem in downtown areas and in America's inner cities. And my resources. Up next, introducing public spaces is Daniela Gomez.
Hello. Okay. Public spaces during the COVID pandemic have become an essential service for recreation, exercise, and relaxation. Built environments with more public spaces have had the opportunity to benefit from these activities, but some environments don't have the same privileges of public space, and in most cases, it's in areas with vulnerable populations. Public spaces also afford built environments with more flexible spaces that can be adapted to specific pandemic needs. Some national parks remained open during the pandemic with limited park services. Visitor and indoor amenities remained closed, while outdoor spaces and some less popular trails were able to be used following CDC guidelines. The National Park Service also waived entrance fees at some national parks in order to encourage people to find recreation outside. Closures of neighborhood and city parks remains varied across states and counties as each have their own policies. Neighborhood parks pose less of a COVID risk as compared to city parks. Popular city parks could attract crowds of people, while neighborhood parks attract only local residents. Other outdoor recreational spaces include beaches and marinas. Because the pandemic struck during the springtime, spikes were seen in southern coastal cities where tourists often spent their summer days. Overcrowded beaches could have attributed to these spikes, and closures were at best a necessary precaution. Closures at popular crowded beaches spread the beach-going population to surrounding beaches, effectively lessening the risks while also allowing for outdoor recreation. According to an article published by The Lancet, isolation can have a negative impact on the mental and physical health of individuals. These adverse effects include acute stress, anxiety, physical exhaustion, among many others. One of the ways they recommend mitigating the adverse effects is to keep people from getting bored. Fresh air and exercise are as essential to the human body as the food and water we risk going out to buy, and can also provide a physical release for pent-up energies. Benefits of spending time outdoors include reducing stress, fighting depression and anxiety. It increases creative drive, improves mental focus, raises vitamin D, and allows people to get more exercise. The Gale study shown on the left shows that public spaces were used mostly for exercise and relaxation during the pandemic. They're both very important activities to keep people healthy. In a way, the public outdoor space replaced many of the other ways we exercise and relax, such as gyms and spas that had to close down during the crisis. In the same Gale study, participants were categorized by age, those under 65 years old and those over 65 years of age. The poll found that 41% of the people who said they would use public space for recreation were people over the age of 65. This higher rate could be contributed to the fact that outdoor public spaces are the safest place to socialize. Another factor that affects this statistic is that people under 65 years have other social outlets other than socializing in person, such as using virtual tools. The same deduction could be made for people living alone versus people living with others. Because public spaces are safer to socialize, people living alone feel safer seeking interactions in those spaces. Access to public spaces across America varies greatly and could depend on the type of demographics in the local area. There is a lack of access to public space within regions that are in poverty. If public space is an essential resource during this pandemic, shouldn't there be opportunity for everyone to have access to this resource? Public parks are not equally distributed throughout America. Minority communities tend to have less and smaller parks than their white counterparts. This results in more crowding within the parks that are available, and crowding creates more risk. Outdoor and public spaces are supposed to be a place of refuge, yet some communities have been denied that opportunity. In the past recession, investments in public parks took a hit, but there is a coming trend of appreciation towards public parks after the COVID crisis, and it has potential to bring more attention to the racial and socioeconomic disparities of public park access. Public spaces such as plazas and fields that host protests and markets are also detrimental during the pandemic. There has been a general state of civil unrest during the pandemic that has stemmed from both lockdown restrictions and health guidelines, as well as responses to social injustices towards Black Americans. Public spaces have been the stage for these protests, and in some cases, protesters have followed health guidelines in maintaining socially distance. This has resulted in reshaping public spaces and marking them using tape or paint, making this free-flowing field into a gridded stage. Outdoor markets and health services have also taken ownership of these territories and have converted them to their advantage in order to stay profitable and provide essential services to their communities. As Daniel mentioned before, with tactical urbanism, there are opportunities to convert urban elements such as streets to public spaces in order to adapt to the changing needs of a community during a pandemic. Examples of these conversions include adapting streets to provide space for outdoor dining, extending sidewalks to provide space for queue lines as well as pedestrian traffic, or closing down streets completely and using the space for markets, recreation, or outdoor classrooms. At the start of the pandemic, many destinations closed, and the US saw a significant decrease in private car usage and an increase in recreational transportation, such as walking and biking. However, public transportation didn't see the same changes because those who typically use public transit are those who have the essential jobs that stayed open. Guidelines and restrictions were put in place in most public transit systems, and there has been no significant correlation in the use of public transit in COVID cases, but the topic requires more research for further analysis. In conclusion, investment in public spaces and public space access could help to mitigate the negative impacts of COVID-19 and any other viral pandemic in the future. In addition, designing flexible and adaptable public spaces such as parks, plazas, and streets could prove to be an asset during such vulnerable times. Thank you.
Thank you, Daniela. Are you gonna go over the conclusions rapidly before we engage the audience in questions? We know that we have a very limited time to conclude this presentation, so we will also like to invite everybody to put questions or ideas or association of interests for us in the website. So go ahead, Daniela, with some conclusions, and then we quickly open.
Okay, sorry, I I said thank you, but we also have a few proposals that we'd like to show.
Okay, quickly, yes.
So Casey's going to go ahead and show them.
You can go ahead to the next slide. This proposal looks at modular construction. This firm designed shipping container intensive care units for coronavirus treatments. The aim is that they can be quickly deployed in cities around the world. Here's another example of modular prefabricated construction. And this project was built in the city of Wuhan in just 10 days. This modular hospital was built by MMW architects and presents an efficient, flexible, and affordable response to the pandemic. The plan allows for maximum efficiency in the layout of the hospital rooms. HA Architects Group created this field rescue center as a concept of a mobile diagnosis and treatment facility. And the modular structure of the facility allows it to be assembled in any configuration depending on the characteristic of the situation. So the next design strategy we'll be looking at is adaptive reuse. Mass Design Group has outlined redesign strategies for restaurants. They've identified 5 key strategies to guide redesign: updating food safety and sanitation codes, sequencing and designated all points of exchange, creating space for a variety of seating configurations, amending current zoning regulations, and designing legible signage. So along with the restaurants, food markets have been targeted for redesign following COVID protocols. The design consists of 16 square grids that can be easily set up in the public squares of any town or city, allowing people to shop local while also following social distancing guidelines. So now Daniela will be talking about the conclusions we've gathered.
Thank you. In general terms, the mitigation strategies identified could be implemented at several scales of design policy, which include federal, state, and local. Meaningful correlations between all these topics should be addressed to isolate vicious circles and promote virtuous association of measures. Examples of some of the strategies within the topics include reinventing spaces that host cultural events, such as theaters, museums, to be in an outdoor setting, innovating virtual cultural experiences, evolving educational strategies. Within social vulnerabilities, we can provide better healthcare services for underserved communities, review codes and guidelines for commercial or public gathering spaces. For the housing topic, we could provide more affordable residential units for underserved communities in order to reduce overcrowding, retrofit and maintain existing public housing stock, and reuse of dismissed industrial office space for housing, which also plays into the urbanism topic. Adaptation through tactical urbanism to facilitate new spaces for gathering and public use, reinventing office spaces to include open floor plans with glass partitions to prevent the spread of COVID-19. Examples in public spaces include equitable access to public spaces, designing flexible and adaptable spaces to increase regulated capacity of businesses, schools, and markets, and prioritize safe and individual modalities of transportation, such as biking and walking. Thank you. If you have any questions, feel free to discuss them in the last minutes of our session or address them to Martha's email and cohen@ufl.edu.
Thank you, presenters. And Well, we encourage some comments. I generally believe that the connections we have made between the pandemic and its physical correlation with the built environment are going to be very fertile in our academic world, into the planning of our future that is going to be different from what it was. We are not going to go back to the previous situation without alterations. And we can see how we can be of use or be poignant into identifying key interventions.
I guess I have a question slash comment. I really appreciated the that you touched on the racial disparities that were kind of exaggerated by the pandemic, and the differences in housing and how those vacancies showed up. Do you think there is a sort of proposal or solution to having like more affordable housing in the post-pandemic world?
The housing lady?
Yeah, I mean, I definitely think the pandemic has shown the inequality of housing. I think, I mean, it's always been there, it's always been a problem, but I think with COVID-19, it's been kind of brought in the light, I suppose. So I definitely think hopefully there'll be change following this pandemic to increase the number of housing in new construction and updating the old houses that are available, because a lot of them are not in great conditions. So I definitely think we'll see changes post-pandemic to allow for more affordable housing.
I kind of saw a connection between like the modular constructions that you guys talked about. I know some groups are making those storage containers into like more affordable housing with the just like singular family home living spaces.
Definitely, yeah.
I think that a good example of that, similar to the housing shortages and idea of public housing, is with food shortages, which we've seen a huge increase with the pandemic. And you see more people lining up for food for like charities that have been giving, like Feeding America, Feeding South Florida has done a lot. And so you've seen already that increase across the pandemic for food. That I think that shortly you will see an increase of either public projects or non-profits that do address the public housing issue.
Thank you.
What I find is that we sometimes tend to focus so much on the medical part of COVID, you know, the disease, the vaccine, all those aspects. And we wanted to bring the other dimension of it, which is how it has impacted in the physical world and in the settlement of our human body, and that is to us especially significant because we see very pointed correlations. For instance, overcrowding in immigrant communities, overcrowding in collective housing. We certainly can act upon that with recommendations. I think answering a little bit what Florence de Assis was saying, the first thing is to be conscious of the situation. So before acting upon it or trying to solve it, at least we have to recognize it and give it its proper dimension within the equation of the problem.
I definitely agree. And I guess one other dimension I was kind of thinking about is the dimension of education. A lot of inner city kids don't have access to computers at home and now are facing a lot of trouble with the distance learning. Yeah, just a thought.
Yeah, I think it's very important to add the education component. What do you say, Thomas Field?
I was just gonna hop in. I'm kind of taking over for Costanzo. She's gonna run the class. I work at the One Health Center, but if there are no more comments or questions, I think we can begin wrapping up. But this was a very, very great presentation. Thank you, Professor Cohen, and all the graduate student presenters. And yeah, I'm really excited we can have these conversations. And that's the idea of all these LenZes seminars, is to zoom in into these different topics around COVID that you might not think about, such as architecture and urbanism, which you might not think is that big of an issue, but once we hear all this data and learn about it, it's a very big, important issue for sure. So thank you all for attending. This has been recorded, so if anyone wants to come back and watch it, we'll have it posted up on our YouTube channel by tomorrow, and also be on our website. And be sure to stay tuned for future LenZes. And yeah, thank you all for coming.
Thank you, Marta.
Thank you.
Thank you, Sarah, for
Nice to
attending.
see you. This was
Nice.
great. Thank you. Bye.
Bye. Well, we'll keep in touch.
Yeah, we'll talk
Thank you,
soon. Bye-bye.
students.